Hi, we're diving deep into a question that's on everybody's mind. Why isn't India vaccinating all its citizens? Is there a shortage? Is the government strategy of controlling every aspect of this the right one? I'm Anubha Bhonsle. This is Newsworthy. Let me try and explain. Public health experts, chief ministers of various states have asked the center to open up vaccination. The central government is against the idea. They want to call all the shots, pun intended. They want to control the pace of vaccination that they feel is fair and practical for a country like India. They want to control the age group. The ministry has already made it clear that vaccination for all age groups is not going to open anytime soon. Only those above 45 can get the shot. They want to control the price. They want to control the fact that it will not be opened to the private sector. And they want to partly control whether manufacturers of these vaccines can export it or not. Now, some of this seems fair, right? The government has a sense of the demand, supply, infrastructure, capacity, and a strategy in place. When the health secretary said that vaccinations are not given to those who want them, but those who need them, it may be bad public health communication, but he was not factually incorrect entirely. The government is saying there is a scientific protocol to be followed. This was valid 4 months ago. Across the world, countries began with this WHO suggestion that prioritize the elderly, healthcare workers, and those with comorbidities for the vaccine. But then all these countries moved on. India is still following this. The second COVID-19 wave has mostly stayed out of the US and UK precisely because of their double-digit vaccination coverage. In the US, for instance, the eligibility criteria varies by state, but 16 years and older are now eligible to be vaccinated in many states, which is how President Biden announced that every adult in the US will be vaccinated by 19th April. 4 months after we started our immunization campaign, just above 5% of India's adults have been vaccinated. 0.8% if you count those who have received both doses of the vaccine. Now, the argument of our large population and therefore small percentages is not valid because even in absolute numbers, only 87 million people have been vaccinated. What is our population? I'm sure you know. So the next obvious question is there a shortage? Is one of the world's largest manufacturers of vaccines, India, facing a shortage of vaccines? Well, the health minister on the 6th of April said categorically that there was no shortage of vaccines at all. But the states, they are saying something else. Haryana, Chhattisgarh, Telangana, and Odisha have all red flagged running out of stock, according to an Economic Times report. Maharashtra's health minister just 3 days ago sounded a warning, saying that the state has only about 1 to 2 days worth of vaccine stock left. The center initially dismissed those claims, calling the state's handling of the pandemic in its entirety lackadaisical, but is now sending 10 lakh units after that SOS. Even though the health minister denied shortages on 6th of April, the health ministry statements on 7th April, 8th April say that both Covishield and Covaxin will be in limited supply till July. So again, mixed up communication and a contradiction. The CEO of Serum Institute, which manufactures Covishield, has also said that manufacturing is quote unquote frankly stressed. So if there's limited supply or manufacturing is stressed, obviously vaccines need to be rationed out for those who truly need it. The question then arises, why is there this short supply of vaccines if there is? Number one, remember we exported millions of doses to over 85 countries until recently. In fact, in mid-March, India told the UN General Assembly that we supplied more COVID-19 vaccines globally than we vaccinated our own people. Now, some exports are part of commercial deals. Some are part of WHO's vaccine alliance, under which India is duty bound. So you can't blame the government for that. But 10.5 million doses were given free of cost as grants. Number 2, the Indian Express is reporting that on an average, we are throwing away 6.5% of all vaccines issued by the center to vaccination sites. Number 3, manufacturing capacity has become strained due to shortage of crucial production inputs. Let me give you an example. The Serum Institute of India warned as early as March that the US government's decision to block exports of certain key items is likely to cause serious bottlenecks, especially when it came to increasing production of Covishield. The crux of the matter is India does need to speed up vaccination, and there have been a whole host of imaginative ideas, suggestions that experts have given and possibly the government is considering. Number 1, add more vaccines to the kitty. Remember, we have 2. The suggestion is we approve some of the vaccines that are in use in other countries, including those from Pfizer or Moderna. Pfizer's vaccine, as you know, has been wildly successful in preventing COVID-19 after just one of their 2 doses. They applied for approval last year, but they were sent back asking for more data. I want to add in a quick note here that India will be manufacturing what is considered the logistically easier single-shot Johnson & Johnson vaccine as part of the initiative of the Quad group of countries, but we are some time away from approval for that one. We're not fools. The average Indian may not be able to afford the Pfizer vaccine, but the truth is millions of Indians can. They can pay for faster access to vaccines, even as the government continues to ramp up free or subsidized vaccination to anyone who can't. There is another suggestion. Allow manufacturers to sell their shots in the private market for anyone who can afford it. Many will opt in, perhaps private companies who are very, very keen to get their employees vaccinated. This would get enough people vaccinated to slow down the spread, and as economist Shruti Rajagopalan argues, it could also help kickstart the economy. The increased sales for companies like Serum Institute and Bharat Biotech means that they can ramp up manufacturing and thus increase supply. I know it's getting long, but just the last idea that's been outlined by economist Alex Tabarrok, he's saying delay the second dose. Listen to this. It's better to bring 2 Indians from 0% to 76% protection than to use the second dose to just bring 1 person from 76 to 82% protection. The US offers AstraZeneca's second dose after 8 months. It is considering delaying it for all vaccines. India, as you know, has pushed the second dose outer limit for Covishield to 8 weeks, but experts are saying we can go further. I'm going to leave it here and of course keep you updated. But until then, if you're eligible or your loved ones are, please get vaccinated. They're safe, effective, and can get us through this pandemic. If you've been watching and this video has been worthy of your time, thank you very much. Remember, we go with Newsworthy with AB on our Instagram handle and on YouTube and Facebook under my name, Anubha Bhonsle. Again, if this has been worthy, there's just another small way that you can support us. Just hit the link in the bio of this handle and you'll see a way to make a small donation, only if you can. From our entire team, thank you for your time.